this is part 2 of occupational therapy in the schools, and we're going to continue our discussion about evaluations and assessment tools. Okay, this first assessment on visual perception you might recognize, as this is the tool that was used last fall. The second years were practicing, and some of you volunteered to be assessed. And if you recall, it looked at visual discrimination, visual memory, spatial relations, figure ground, visual closure, that type of thing. The test of visual perception skills is a very similar kind of assessment, but you get a comprehensive motor free. You can break it down into the different subtests. And then the VMI is another one. This program combines motor and visual perception, and that the child has to shape and they have to reproduce it. And it goes from very simple geometric shapes to very complex. We also have sensory assessments. Winnie Dunn created a sensory profile. It was recently updated. This is a questionnaire that's given to parents, caregivers who know the child very well, and they now have added a school companion at different tasks that the child might do in the school to see if they're having any difficulty responding from a sensory perspective. And the sensory motor performance analysis is another assessment. This is an actual performance measure where you would observe the child doing gross and fine motor tasks, and then to figure out exactly why they're having difficulty performing. It breaks it down into the different sensory. All of the assessments, the fine motor, perceptual, and sensory assessments I just talked about, would all be considered bottom-up approaches. They're looking at specific components to determine why a child is having difficulty with their occupational performance. But we also want to consider, I think in OT we need to look at both a top-down and a bottom-up approach, and you need to get a comprehensive big picture of what's going on. And so these assessments might be used to determine, you get a more comprehensive picture of what's going on. The school functional assessment doesn't necessarily look at academic performance, but how well is the child in both motor and cognitive skills able to go through their school day, going to the playground, going to the cafeteria, out at recess, getting off and on the bus. There's supplies that they need in order to do their math skills. PD is a questionnaire that looks at 3 different areas. It looks at self-care, mobility, and social functioning. It also gives a comprehensive picture of the child's strengths and weaknesses. And then just your clinical observation skills. Sometimes just observing and doing a task analysis really helps give you a clear picture of what's going on with the child. Most likely, if a child is referred to occupational therapy, a problem has been identified. But the school system only has to provide services that are educationally relevant. That's the purpose. Of therapy, occupational therapy in the school system. Primary concern is whether the child's fine motor, self-help, written communication, sensory deficits are significantly interfering with the child's educational program. So they might have these issues, but if it's not interfering with their education, then they're not going to qualify for services. The other thing that therapy intervention you have to have a potential for change in the student's educational functioning. So even though a child might be very delayed in terms of, if you compared them to a typical developing child, say they're chronologically, they're 7 years of age, but they're functioning like a 4-year-old child, yeah, they have problems, but their potential to make significant changes in their education is not real high because of their cognitive deficits, then they're not going to qualify for therapy services. That's really a hard thing for parents to understand because they're only looking at the occupation of education. To complicate it even more, to qualify for OT services, there's specific developmental criteria that has to be met. First of all, in any of the assessments they do, so this is why you want to give a standardized norm referenced test, that it has to be at least 1 standard deviation below functional performance of all age groups. It's not below their chronological age, but below their functional performance. They're between 3 and 5 years, 6 months. They have to be at least 6 months below their functional performance, but it gets harder and harder the older the child gets. So So in that example, you have a 4-year-old child, they would have to be functioning at 3 years 6-month level or greater in order to qualify for services. But say they turn 5 years 7 months or 6 years of age, now they have to be a whole year behind that 4-year level. And if they're between 10 and 21 years of age, they have to be a year and a half behind. I know it seems a little confusing, but again, I think that those qualifications are spelled out in the ruling, that they have to show potential for benefiting their educational need, and that's why they have established these criteria. Now, with that being said, the child could also, they have a few exceptions. If a child has a motor, a neuromuscular, or orthopedic concern, then the child could receive OT services. If OT, without OT, rests. So they have to maintain, in order for the child to maintain their current level of functioning, and only do that if they can continue to have OT services. Or if they have a neuromuscular condition that's progressive, OT intervention slows down that progression. So for example, a child with muscular dystrophy, if OT can progression of the disorder from keeping it slowed down a little bit, then they would still qualify for OT. Allow OT services for if a child has difficulty with sensory awareness, motor planning, and organization of adaptive responses. So there are some exceptions to that developmental rule that we talked about. I'm going to look specifically at some of the roles of OT. And I'm not going to read this whole list, but we're going to go over each one of these areas as we continue. So the first, and we've already talked about this a little bit, is to evaluate. And so we want to determine what are the underlying problems. So I'm going to look at from the bottom-up perspective, what motor components, what visual motor, what visual perception, sensory motor deficits interferes with the child's education. We're going to and through that, we're going to help problem solve with the teachers and other members of the IEP team, which the IEP stands for Individual Educational Plan. And we're going to look at the child's strengths and abilities to develop a plan for the child. I think one of the things that OT has to offer in the school system is our understanding and our knowledge of normal development and even abnormal development. And so we can help the teacher, and I'm not sure how much background information teachers have in terms of development of the child. Looking at their hand skills or motor skills, or even the progression of sensory abilities. And so we can help kind of predict what's going to happen based on our understanding of development. Through task analysis, we can figure out what the and our clinical reasoning skills. We can look at what the problem is and what are some intervention strategies to help get the child to the next level. Sometimes it may be included in things like providing adaptive equipment or alternate ways the teacher might be able to teach in order for the child to reach the next level. We're also very good at being able to adapt or modify the classroom environment. We might use seating or positioning modifications to help the children. These children are sitting on balls. For a child who has attention problems or sensory processing problems, the movement of the balls may be enough to help keep them focused on task. The angle of having a vertical angle for handwriting can biomechanically put the child at an advantage to improve their grasp on a pencil and possibly legibility, or even things like classroom management for behavior kinds of issues. OTs have that ability to assist with classroom environments. specifically, we taught handwriting's probably one of the biggest because that does impact education. Sometimes that's one of the biggest referrals, is that a teacher will see a child with some kind of funky grip on their pencil. And when we talk about handwriting, I'll tell you about my theories about all that. But so sometimes it's using a piece of adaptive equipment like a pencil grip or handy writer, having the vertical surfaces again, or some sort of adaptive crayon or marker or paint, scissors to help the child with their written output. Sometimes, though, it may be that no, it's just too cumbersome. The legibility is really poor. It's going to take a lot of effort, or maybe the rate of handwriting itself is just really too slow, especially when they get up in the 3rd or 4th grade, where they're now supposed to be composing paragraphs and essays. And if it takes them a really long time to write out that information, they're not going to be they're going to limit the amount of words that they put down. So it may be at that point it would be time to move on to a computer and make that adaptation, and maybe because the purpose is to get participation in written communication. So this is an example of an assessment tool, the Minnesota Handwriting Assessment, and it looks at legibility, it looks at neatness, how the size of the letters, whether or not they're on the line, whether or not they're oriented the right way, the alignment is good, how much pressure is put on the paper, all those kinds of things, to give a beginning point, and then you can through the initial assessment, you can reevaluate to determine what kind of progress has been made. We also can look at the child's playground. Some schools are going to have adaptive playgrounds that allow for improved social participation. And other schools are not going to have those kind of adaptive environments for a child who is physically disabled. I think it's one of our roles and responsibilities is to advocate for the children, to help get the kinds of equipment that they need in order to participate. For motor, the primary role of OT is to determine how the child will physically access equipment. It may be the positioning and seating that you look at, but it also might be their accessibility to activate, say, a computer or a augmentative communication device. So OTs were going to be working very closely with the child and, say, for example, speech therapy to figure out the right kind of system for the child, maybe using a head switch to activate the device. They may have to use an alternative site like their elbow or their knee to access the switch. Splinting, I wouldn't think that's the most common thing in the schools, but that range of motion or movement to help with positioning. And one of the things in the last 20 years, certainly, not even the last 10 years, that the assistive technology has just really blossomed. It's much more readily available for all children. Years ago, as we were beginning to develop it for our kids who are motorically challenged, I think that with the advent of all the apps, there are so many more programs that help with improved motivation and alternative ways of learning that can be used in the classroom. And this is another area that OT works in on the school system is find what kind of adaptive equipment is needed. Maybe the child needs a built-up spoon or a swivel suck from a straw. Can they manage themselves in a noisy environment in the cafeteria, or do they need to have quiet? Many children have, from our autism spectrum to other children with sensory processing disorders, who have difficulty paying attention to their tasks that they need to because they're responding to the sounds and sights and smells of the environment. So you have to provide them with what's called a sensory diet, which is a different strategies that increase the student's ability to have acceptable work positions, if you will. They might be sitting on a ball, like the picture we saw earlier. They might be working prone on elbows. They might go out and swing right before they have an examination, or jump on the trampoline to help them focus. Vests or lap blankets may help them just calm their nervous systems down so that they can function and focus on what they need